Hello and welcome to day 2 of week 2. Now, if you remember from day 1, we did talk about chapter 34, and we talked about asepsis and what your role is when it comes to medical and surgical asepsis. So for the rest of this week and today's video, I'm going to focus on chapter 42 and chapter 35. 34 we did again talk about in day 1. I'm going to start with talking about chapter 42, and I will end the video talking about chapter 35. So chapter 42 is focusing on how medical assistants help to assist with minor surgery. As a medical assistant, you may be asked at any time to help a provider with a minor surgery, and there's some specific ways to help set up a sterile environment. So when you're assisting with a surgery, you will need to use the surgical asepsis. Again, remember that means that you want to be completely sterile and kill all those endospores. So you will be using the sterile technique. It has no microorganisms present as they were destroyed during that sterilization process. You'll want to use a surgical scrub, which will be very different from that of a medical aseptic hand wash. You'll want to use sterile equipment and set up a sterile field. So when we're talking about performing a sterile scrub, you want to make sure that you remove all of your jewelry, your lab coats, and you want to roll up your sleeves all the way up to the shoulders, just as you see here with these two gentlemen. They've rolled their sleeves all the way up. You want to use warm water and have your hands pointing upward as opposed to downward. That way all of the water rinses off of the elbow as opposed to the hands. Your elbows will not be sterile, but they will be facing the back of your body, so that is not important. You'll lather up the soap into your hands and use a scrub brush and scrub all the way up to your elbow, roughly about 5 minutes per hand. You'll rinse from your fingertips down to your elbow, again, so the water runs off your elbow. And once you are dry, you will immediately put on sterile gloves, and remember that your hands need to stay above your waist. If your hands fall below your waist, you will need to re-sterilize yourself, the patient, the scrub room, and the provider. So please make sure that your hands stay above your waist. Surgical gloving, on the other hand, which is this picture over on the right-hand side, is actually you'll use a package of gloves, and you always place the package on a flat surface. You'll always only touch the outside 1 inch of the package. That is the only part that is considered unsterile or contaminated. You always want to glove your dominant hand first. You do not ever touch the outside of the glove with your non-gloved hand because that is considered sterile and your hands are not. And then once your dominant hand is gloved, you will then need to slide your non-dominant hand into the other glove and then tuck that glove over the wrist of the non-dominant hand. It's very hard to try to describe this in a video, so we will be performing this in class. But I do want you to review procedures 42.1, 42.2, and 42.3 prior to class on day 2. Now, chapter 35 is getting into the discussion of vital signs. I know that this is something that is very exciting for you guys because you're already kind of jumping in and getting your paws wet, learning some of the skills of a medical assistant. So we will spend several weeks working on vital signs. But vital signs are really the full responsibility of the clinical medical assistant. Vital signs are able to give the provider a quick snapshot of how the patient's body is really functioning, and there are 6 main vital signs that you will be responsible for. The 6 main ones are weight, height, temperature, blood pressure, pulse, and respiration. So let's take a deeper look into each of those individually, and then we will be performing them later this week. So the first one I want to talk about is taking someone's weight or a patient's weight. This is one of the first vital signs that you will ever take for patients, as it's easier to take their weight when they're already standing up and walking into the exam room, as opposed to letting them sit down, get comfortable, and then get back up onto the scale. You always want to make sure that your patient's weight is taken in a private area to make them feel more comfortable and at ease with having that procedure done. You always want to have the patients remove their shoes and any heavy outerwear, such as maybe winter jackets, heavy sweaters, or multiple layers of that sort. You want to get the most accurate weight that you can without getting the patient down to a gown. Now, if your patient does refuse to either remove items or have their weight taken, you do want to make sure that you document that in a chart, because if it's left off, the providers will become very angry. They cannot fully diagnose or prescribe medications without the patient's height and weight. And when we're documenting weight, it's always recorded in pounds, as you see in the example on your screens. Weight is the next thing that you will take, and typically you'll want to take height and weight together, as the patient will already be on the scale. But in order to get a true patient height, you should have your patients do this without their shoes on. Obviously, shoes do add a little bit of height. Preferably, we say to remove their shoes because it can add about 1 inch to 2 inches, depending on the shoe that they're wearing. Have your patients make sure they stand all the way back with their heels, buttocks, and back of the head touching the wall or the measuring stick. Then the L-shaped bar on the top will go directly onto the top of the patient's head, making sure it's at a 90-degree angle, and you record their height where the bar reads. Typically, it does have another line or lineage on it for you. Now, when you record patient's height, it's always recorded in inches only. So, as you can see in the example, 65 inches instead of 5'4". Temperature is the next procedure or vital sign we'll talk about. It's important to know that the normal body temperature is 98.6 degrees Fahrenheit. Generally, we typically always record things in Fahrenheit, as Celsius is not something we use very often here in the United States. There are 5 sites that we typically take temperature from, either orally or under the tongue, rectally, the axillary, which is under the armpit, aoral, which is in the ear, and temporal, which is across the forehead using the temporal lobes. Now, body temperature is usually at its lowest first thing in the morning and rises throughout the day. And there are many factors that can affect a patient's temperature, things such as time of day, maybe age or gender, if they've been physically exercising or if they're having any sort of emotional problems, pregnancy, certain environments they're in, infections, medications, and food can all cause different temperature changes. Next thing we're going to talk about is pulse and respirations. These two typically do go together. As you see under the respirations, that paramedic is taking both pulse and respirations. We do this so that the patient's breathing doesn't change when we're trying to take respirations. But pulse is the number of times that the heart beats per minute. The pulse is a wave of blood that comes through the body when the left ventricle contracts and then relaxes. The average adult pulse rate is anywhere from 60 to 80 beats per minute. And the most common site to take a pulse is at the radial artery, which is located on the thumb side of your wrist, as you see in the photo. Again, there are factors that do affect your pulse. Again, exercise, age, and gender are the same. Maybe size, physical condition, if they have a disease, what the condition of that is, medications, depression, fear, anxiety, and anger can all cause problems with their pulse as well. For respirations, this is the act of them physically breathing, and it's the process of one inhalation and one exhalation counts as one cycle. Respiration rates indicate how well oxygen is being provided to the tissues of your body. Respirations, again, should be taken at the same time as your pulse so that the patient does not alter their normal breathing pattern. An average adult has a respiration rate of 12 to 20 breaths per minute. And usually, again, there are factors that will indicate or change the respiration rate. Most are the same as that of the pulse rate, except for that of an allergic reaction. If a patient's having an allergic reaction, it typically can change their respirations, either by increasing it or decreasing it. And the final vital sign is the most important one that we will ever talk about, and that's your blood pressure. Blood pressure actually helps to aid in the diagnosis and treatment of a patient. And when we're talking about taking a blood pressure, there are two very consistent and important numbers that you'll look at, the systolic and the diastolic. Systolic pressure is the first beat that's typically heard, and this is when the heart is going to actually contract and pump out the blood. Diastolic is the last beat that you will hear, and it's typically when the heart starts to relax back down. When you're recording blood pressure, it is recorded as a fraction, so as you see in the example there, 120/80. And that actually happens to be the average adult blood pressure, but that is rapidly changing throughout time and studies that have been done. There are two key pieces of equipment that you need when you're taking a blood pressure, and that is your stethoscope and your sphygmomanometer, or the blood pressure cuff. And just like any other vital signs, there are factors that can affect your blood pressure, such as emotions, age, exercise, obesity, certain diseases, if the patient's in shock or dehydrated, or if they're having any sort of anxiety, or maybe they have white coat syndrome and they're nervous about going to the doctor's office. So, in prepping yourself for the day 2 of week 2, I'm going to ask you to make sure that you bring all of your equipment to class, including your vital sign equipment. You'll want to make sure, again, that you have read chapters 42 and 35, as they will help you for procedures that we will do in class this week. If you have any questions or comments, please bring them to class, and I will help you address those in class this week. Have a wonderful week, guys, and I'll see you on day 2. Bye-bye.